Good morning, I'm Kim Alexis. Okay, ladies, we know we can talk to each other about anything, but there's some topics women steer clear from, and we shouldn't. So today we're going to talk openly about female pelvic health conditions, because 1/3 of you watching right now will be affected. Joining us now is Dr. Felice Colleton, a gynecologist and one of the most decorated female athletes in Winter Olympic history, speed skater Bonnie Blair. Welcome.
Thank you.
Now, many may be watching us at the breakfast table with your children, so a word of warning. Some might consider this health discussion a bit graphic. Today, we are talking about female pelvic health conditions. First, doctor, how common are they?
Well, approximately 1 in 3 women will suffer from some female health condition before the age of 65. These include conditions such as heavy periods, also called menorrhagia, or fibroids, which are benign growths in the wall of the uterus, which can cause pain or infertility. They can suffer from things like stress incontinence, which is the loss of urine when you cough or sneeze, or pelvic organ prolapse, which is when the pelvic organs sink down into the vagina from weakness in the pelvic floor.
And Bonnie, these are not normal things to talk about. What made you get involved with this?
Well, I wound up suffering from SUI, or stress urinary incontinence, and didn't realize at first that it was something that was so common and affects so many women. It's a difficult subject to talk about. I even hid it from my husband for a while, but once I talked to my doctor and realized there was something that could cure me from this, I was like, okay, let's go there, let's get it done and be done with it.
Was there something that all of a sudden made you decide this is enough to go to seek help?
Well, I think one of the things was it really interrupted my lifestyle. Simple things that you would do, whether it's opening up the refrigerator, getting something off the bottom shelf, lifting up a laundry basket, picking up your kid. And for me to go running, something that I love to do and enjoy, it challenged my lifestyle. So by realizing there was a treatment and that I could get cured, I got my lifestyle back, and that's huge.
And doctor, it's easy to get your life back with a treatment?
Well, these conditions are common, but they're not normal. They are treatable. There's medication sometimes that we use. Sometimes we prescribe exercises such as Kegel exercises, or sometimes surgery.
So the treatments and risks, are there any risks?
Well, there's always risk to any treatment, and you should talk to your doctor about the risks.
What causes these pelvic health conditions, and who's most likely to be affected?
Well, there are multiple causes. It is very common, but you need to remember it's not normal. Some of the most likely sources are genetics, definitely. Having children increases your risk of these conditions. Getting older or smoking. Obesity is also a risk factor.
She talks about getting older, and that was one of the things, the SUI happened to me when I was in my 30s. So, it isn't something that's just for somebody that's older, and I think that's important for a lot of women to realize.
Now, Bonnie, you obviously got involved in this, and you are a spokesperson for this. How can women find out more about it?
Yeah, I've worked with Ethicon now for quite a few years, and there is a website, pelvichealthsolutions.com. Even there's like a quiz you can take, ask you questions, try to figure out what things are really wrong with you, and then gives you questions to go and ask a doctor to say, okay, hey, help me out here.
Right. Well, great information, and we can talk about anything, right?
Exactly.
Exactly.
That's right, yes.
Thank you very much, ladies.
You're welcome.
Thanks.
Thank you.